This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended. He's an elderly male patient who has this black cataract, some most mature grade 5 nucleus, and let's see what are the strategies one has to employ to deal with such dense nucleus. As the incisions are being made, we need to plan our surgeries accordingly. So rhexis has to be adequately large. It should not be less than 5.5 millimeter, because while dividing the nucleus, the maneuvering inside the capsule bag will be much, and the chances of tugging at the rhexis margin will be higher during lateral separation. That's the reason why we need to give adequate buffer of having a bigger rhexis. The nucleus division is going to be a challenge. In this case, I'm going to try the direct chop technique, and if I find it very tenacious and difficult to crack, then I will be shifting over to the 4-quadrant divide and conquer technique, and let's see how things are done. So the rhexis is done, and now is the time to begin the nucleus management. Now in such cataracts, even though I'm planned a direct vertical chop in this case, I would like to create a small central pit. So the nucleus is stabilized with my second instrument, and I'm begin trenching. The idea of creating this pit is that we get access to the deeper core of the nucleus, and that allows us to bury the tip much more deeper and get a proper hold so that we can chop effectively. The secret of vertical chopping is to have very good grip, and this is the best way to hold this very large, bulky and dense nucleus. We don't have to create this trench for softer nucleus, but for nuclei of such grade, it's better to create this trench. The idea is to hold it at its core. The tip is buried into the substance of the nucleus. The vertical sharp chopper goes in front of it. The right hand with the phaco tip moves up ever so slightly, where the left hand goes down and then to the left, inducing the crack in the posterior plate. I was expecting the nucleus to talk, but it didn't. That was good. The nucleus is rotated, and here you can see that my tip has not buried deep enough. So I'm unable to get a good hold, and the chop would not be successful. I change the position, bury the tip into a much more deeper place, and then I can get a successful chop. The nucleus is again buried deeper, and the chopper goes in front of the tip, goes down, and then there's a lateral separation maneuver. So the first heminucleus, we could get these 3 fragments which are reasonably well separated from each other. Somehow I feel that the central part is still attached to the other heminucleus. The nucleus is rotated, and I'm beginning to do the chop maneuvers in the second heminucleus. And as we reach the posterior plate, it becomes very, very tenacious, and multiple attempts are required to do the lateral separation maneuvers, but still some amount of fibers are still holding down near the base. Chop maneuver is repeated. The proximal or the upper half of the fragments are totally free, but however, the posterior aspect of the fragments is still attached to the common posterior plate. So we can see that the distal part of the fragments are all cracked up, whereas the central, maybe 3 mm zone, all of these fragments are still held on to each other at the posterior plate. So OVD is replenished. Now the plan is to evacuate few fragments and then deal with that attachment which is holding these pieces at the base. So I believe at least one fragment would be free, and my goal is to take out one of the fragments. That would create some space, and then we will try out the flip the base up and phaco technique. So the one fragment, I'm just pulling it out and trying to emulsify. Although some of its roots are still attached to the posterior plate, at least I want to emulsify 2/3 of the fragment so that it will create some space and further maneuvering will be much more easier. The central endonucleus we're able to see, which is now dislodged. The small 3 mm endonucleus is dislodged and is consumed. Time for the next adjacent, a larger fragment. It is pulled up. I'm trying to do a cross chop, that is trying to cut at the bottom of its attachment and then emulsify it. This cross chop might not be the safest way because we are going underneath the nuclear fragment, and for a moment we are blinded regarding the position of the chopper, and it could be inadvertently very near the posterior capsule. So that is one disadvantage of using this cross chop. So now we have a situation. As the OVD is being filled into the chamber, let me interpret the situation for you. So we have all the fragments snugly packed against each other except this quadrant where it is free. The proximal ends are all free, but they're all joined at the central 3 mm. So this is what the fragments are. I could somehow separate one fragment, and we can clearly see that there's a bridge which is holding these two fragments together. With the Sinskuk, I push up this bridge up. The bridge is now at the level of the access margin, and the access is excellent. So the idea is to go ahead and just break this bridge which is holding these two fragments together by using Phaco energy with low flow rate and vacuum. And in a very controlled manner, the attachments between these two fragments is destroyed effortlessly. So I'm going to push these fragments back into the bag because I don't want them fluttering in the antechamber. So I'm just going to push them back into the bag and then emulsify them one by one. So again, I want to push in OVD because as the fragments are trying to come out of the bag, my concern is I don't want to emulsify it in the antechamber. So I just want to push them back into the bag. These corneas would take a hit if we emulsify in the antechamber, especially with these dense fragments. So there is a higher chance of mechanical damage to the endothelium. So all the fragments are now pushed back into the bag, and now is the time to emulsify them again one by one. As the fragment is being emulsified, I've asked my assistant to keep pouring BSS on the wound so that it just keeps a little bit clean. Please note the position of the bevel of the Phaco tip. I prefer to keep it sideways, especially to the left side when I'm doing quadrant removal. The idea here is that by doing so, the nuclear fragments are exposed to the widest surface area of the tip. As we're using a peristaltic pump, it's easier for us to build the vacuum rapidly if the occlusion happens quicker. Aligning the Phaco tip towards the nuclear fragments is going to ensure that the occlusion happens quickly. And nevertheless, to prevent chatter, we need to use the energy very judiciously. So all the fragments are emulsified one by one under the cover of OVD. So let me pause the video here for a moment and just show you this white spot which is developed. Well, this is the earliest sign of thermal injury. This whitening of the cornea is because of the wound burn which has happened. Now this is very tiny burn and this is not going to be any concern, but just wanted to demonstrate how it looks. So this happened because I was using a longitudinal energy during chopping mode, and compared to torsional, the longitudinal energy does generate significant amount of heat. And when the tip gets occluded and still we have used Phaco, then there is a risk of the temperature building up. So this is how the wound looks now once the Phaco is done. You can still see the white spot and it has continued to remain the same. It has not increased, and this is not going to have any post-operative consequence, and it should heal well. The cortex is aspirated and the lens is implanted into the bag. Okay, to summarize, in these hard cataracts, when you do a direct chop, there is always a possibility that the posterior plate might not crack entirely, especially in the central 3 mm. So we have a flower petal-like situation where the petals are still attached at the center. So this is where we propose our flip the base up and Phaco concept. And the only requirement is we have to eat up one or two fragments so that we create space, and then where the bridge which is at the posterior plate can be flipped anteriorly and then destroyed using Phaco energy in a controlled manner. So this was it. Thank you for watching and hope you found this helpful.